Hi guys, Dr. Joe Camisa here of Camisa Physical Therapy and Sports Rehab. Considering that the nation is going through this COVID-19 crisis, I just wanted to update everyone on the steps that we're taking and the new services that we're going to be rolling out. So number one, everybody's practicing social distancing. So there's a lot of people who are feeling uncomfortable coming into the clinic. And what we're doing in the clinic is we're practicing enhanced sanitation practices. We're always trying to keep everything very clean, but we're even upping that a lot more, Lysoling everything that patients touch, using gloves for the staff, everything that we can do, just enhancing it all. And we're even actually spreading out our appointments since we have the ability to do that with lower foot traffic in the door. We're trying to spread out our appointments so that there's not too many people here at one time. That being said, for many people that are uncomfortable coming to the clinic, a lot of people are staying at home. We're actually expanding our services to offer telehealth or Telerehab, where you can communicate with me just like we're doing right now on audio-video app on your smartphone or your laptop or your tablet, and I can offer you advice, education, and even evaluate you remotely via social media. So we're using the DoxyMe app, which is HIPAA compliant, and so we can continue your therapy that way. And I know what a lot of people are thinking, oh, well, if I can't get manual therapy, how can that be effective physical therapy? And it's true, manual therapy is for some people an absolute necessity, but it is only a small part of physical therapy. Most of what we're doing, the way I treat, is we're trying to basically, in a nutshell, help people move better. And the manual therapy helps to have people move better and helps you get better faster, accelerates the process. But what keeps you better is knowing how your injury mechanism is produced, knowing what your pain triggers are and how to avoid them with your daily activities, and also doing the right exercises to build your deficits and keep your body strong and keep making progress. It's the exercise and the education that's going to keep you better. The manual therapy helps you get better faster, but it's really the exercise and the education that you get that really kind of helps you stay that way. And yes, for some people, manual therapy is going to be absolutely necessary. And there's even some tips that I can do remotely to help you work on yourself, give you some self-myofascial release techniques. Whether you own a set of cups or you own some sort of trigger point release device or roller, I can give you tips on how to do some manual therapy on yourself remotely. Another thing that we can do remotely is, if you're at your computer all day and your posture is not so great and that's contributing to your injury mechanism, I can look at your exact workstation at home. You can show me where you sit, where you stand, and I can give you tips on how to adjust that to make it better, make you have better ergonomics. I could even suggest maybe some equipment you can buy on Amazon that can ship right to your door, lumbar supports or things like that, a document holder, different tips on how to make things less stressful so you avoid fatigue during your workday. If you have different problems with daily tasks, how to do the dishes or pick up something at home or a specific task that's giving you pain, I can actually look at you in your home doing that task, and we can see if there's a better strategy for you. So I just wanted to update you guys on the things that we're doing and let you know that we're still here. We're offering these services. Our offices are going to remain open unless we're told to shut down. But right now, physical therapy is considered an essential service. So essential service meaning if you do have musculoskeletal pain, that the physical therapist is considered a primary care provider for movement and musculoskeletal pain. So if you throw your back out or you hurt your shoulder or something, don't go to the ER or your doctor's office, and let's try to reserve those places for people with the COVID-19 virus or have some sort of emergency like a stroke or a heart attack or something like that. Physical therapists, we can evaluate those injuries and those issues, and we can triage those patients. You don't need a referral for up to 30 days in New Jersey. And then if you do have something that's outside the scope of the physical therapist practice, we will refer you to the proper physician and get you the medical care that you need. So I just wanted to update everybody on what we're doing. And also for the current patients, we want to make sure that we're still monitoring you and that your programs are still effective. So if something's not right, we can look at them via the Telehealth and see if we can tweak the program a little bit to make sure you're continuing to make progress. So again, this is Dr. Joe Camisa, Camisa Physical Therapy and Sports Rehab. Hope you all staying safe and practice your social distancing, your physical distancing, but not the social distancing, because we can still connect via social media.